The questions are, is my urine sterile? Can I drink my urine? Good day, everyone. I'm Gwendolyn Halle, a seasoned and certified medical microbiologist, and I'm popularly known as the medical professional with the difference because I bring you knowledge on health, medicals, and a lot more. If you're just joining this channel, please join the family, subscribe, and turn on the notification bell. And if you're a returning subscriber, Bisous. I want to say I love you. Thank you so much for giving visibility to my channel. I love you. Let's go there. Welcome back. In today's class, we're going to be looking at urine. What our urine says about our health, or what your urine says about your health. We have watched several videos online and we see a lot of people who say it's safe for them to drink their urine because urine is sterile, and it doesn't contain any microorganisms. And as a medical microbiologist, I would say that is false. Some arguments say that that's why medical microbiologists use urine as a medium to test for the presence of any microorganisms. And that is true. Urine is a very good medium and it's one of the most common mediums that we use, to actually run some tests or culture to see if there are any microorganisms. We do urinalysis, we do cultures, and a lot more. But the truth is, urine isn't sterile, it's not what you should drink. You shouldn't drink urine because in as much as you are healthy, your body still passes out some bacteria in your urine. And not only that, you may have protein in your urine. Not only that, you may have other components in your urine. Remember that urine is produced by the kidney and it contains salt, uric acid, and urea. So most times these components could be harmful or be toxic to our health in the long run. A lot of people have said that urine has helped them to detox their bodies. I don't know how far that research is true because as a scientist, I've done a lot of research and I haven't seen any, concrete, experiment and research or result that has really stamped and stated that yes, urine is safe for drinking. In space, what NASA does on some of these organizations that actually go into space, they actually drink their urine, not directly. When they pass out urine in the toilet, it goes through a certain system, a purification system, and it is purified, filtered, and then pumped out again through the tap. So that's what happens there. But so far, peeing immediately and drinking it, I wouldn't advise. There are people who boil their urine and have to drink it. There are people who claim that if you are in a desert area where there is no water, you can actually boil your urine and filter it and drink. So far, as a medical microbiologist, I wouldn't say that is 100% safe. Now, let's dive into our main topic for today. What does your urine say about your health? All through our lifetimes, as from adulthood, from being a toddler to adulthood, you notice that your urine changes in different days, different hours, different seasons of our lives. And that's because our urine tells a lot about our health. Now, let's go there. If we look at the chart we have, when you have pale yellow urine, you are well hydrated. When you have dark yellow urine, you need to drink more water and more fluids. And if your urine is amber in color, that means you are dehydrated. And if your urine is orange in color, that means that you may have a liver disease, or it may be caused by some form of medications or foods that you are taking. But I would like you to be very cautious. If your urine is pale yellow in color and it's cloudy, that is a sign that you have a urinary tract infection or you may have protein in your urine. But most importantly, you should check if you're experiencing a burning sensation while passing out urine or pain while urinating. So let's continue to the next chart. Now, on this next chart, we'll look at specific colors and what they actually mean. When we're looking at pale yellow, we are looking at a healthy human and a well-hydrated human. When we're looking at bright yellow, we are seeing excess vitamin B. When we're looking at the red color, we will say there's blood in the urine, or you may be eating foods that actually are red in color, like beetroot, or you may have eaten foods that contain dye. Also, when you find that our urine is orange in color, it means that we are dehydrated and that we are taking certain drugs or medications, or maybe even a lot of carrots that may cause our urine to be that color. Now, when you have a greenish urine, we would say that this may be due to food dyes or drugs that contain phenol or drugs that are antidepressants or some infections. Now, when we are looking at a brown color, we are talking about an individual who may have an infection or that is taking antibiotics or antipsychotic drugs or some form of laxatives. Now, purple color of urine is so rare. I mean, very rare. And this is mostly caused by a metabolic disorder. In this case, we're talking about porphyria. Now, whatever color your urine is, please see the doctor. See the doctor. Your urine may be pale yellow, but if it's cloudy, that means you have a UTI infection or another infection in your body. Use your urine as your own petri dish, as your own medium for you to check if you're in good health or not. Because as an individual, as a medical microbiologist, I know when the color of my urine changes. I know when I start getting amber color and orange color, I know that it may be because I'm dehydrated or maybe because of the drugs I'm taking. Most especially when I'm taking drugs, my urine is normally different in color. But while you're taking drugs, this is an advice for everybody. Make sure you take a lot of water so that it doesn't weigh on your kidney. Your kidney needs a lot of water, fluid, to actually process and filter out all the toxins, and water is very important. Remember that your drugs also has components or ingredients that needs to be flushed out of your body. And when there isn't enough water, or if you are not well hydrated, these components or these ingredients stay in your body and may cause fatigue and may actually affect your body smell. They may actually affect your breath. They may actually alter your metabolism. So please do stay hydrated and stay in good health. Remember, I remain your seasoned and certified medical professional. Bye-bye.